Hey everyone, I'm Dr. Tank, and in today's video, we're going to be discussing an exciting development that's transforming medical care, AI technology. So you've probably heard of AI by now. However, did you know that we're using it today, as of September 2023, to help optimize and streamline your care? Let's talk about it. One area where AI has shown increased promise is in the identification of acute strokes. Now, we all know that strokes are very common in the ER. However, what's even more important is that you receive stroke care in a timely manner. We say time is neuron, and the longer you wait, the more brain cells could potentially be harmed. So how is AI helping us to advance stroke care? In order to get into this, we have to talk about how we used to do things. So when a patient comes to the ER with stroke symptoms, this can usually be numbness, weakness, slurred speech, or facial drooping, then typically we call a code stroke or a stroke alert. What this means is the patient gets whisked off to the CT scanner and they get some scans of their head. Sometimes this will also include a CT angiogram, which involves IV contrast to assess the blood vessels of the head and neck. Now, these images would later have to be sent to a radiologist to get interpreted, and sometimes you might need a special type of radiologist, such as a neuroradiologist, to read the angiogram. Typically, we get our reads within 5 minutes. However, sometimes it can take longer for that angiogram. Sometimes we get a call telling us that there is an acute stroke or an intracranial bleed. We can then treat the patient appropriately. If there is something known as a large vessel occlusion, then this patient might be a candidate for special intervention. This involves sometimes transferring the patient to a higher level of care, as only certain specialties can perform this intervention. Now let's talk about how AI is helping us to streamline this process. So now let's say the same patient comes in with stroke symptoms and they still get whisked off to the CT scanner. Now there's certain AI software that will actually interpret those images, and you'll be identified pretty quickly via a text notification. So for example, if you are coming in with stroke symptoms and the AI software detects a large vessel occlusion, it will notify the interventional radiologist or the interventional neurologist at a nearby facility. What I've seen happen in the ER is sometimes we'll get a phone call from the stroke coordinator saying, hey, we just got flagged that you have a patient with this particular diagnosis based on the AI software, and we'd like to transport the patient here for intervention. Now, all this happens simultaneously, and all this happens before there's an official report from the radiologist. Now, of course, the specialist on the other side should review the scans themselves and likely will agree with or disagree with the AI interpretation. But needless to say, it can definitely save minutes, which every second does count when you're dealing with stroke. The AI software also connects all the physicians and team members via a group thread, and it will also push the patient's images over. We can also tell them from our point that we are sending the patient by ambulance and they will be here within 5 or 10 minutes or whatever it is. And ultimately, everyone's on the same page trying to get this patient the care that they need as soon as possible. Now, this is just one application of AI, but it does open the door to many other possibilities. It seems like the potential of AI in the emergency department is vast. As it continues to evolve, we can anticipate even more precise diagnoses, streamlined workflows, and ultimately improve patient outcomes. My understanding is that this technology is currently available in the United States and in some parts of Europe, but I believe it's likely going to be expanding to other emergency departments. Thanks for joining me in this quick video regarding AI in the emergency department. I'd love to hear more about AI's uses in other emergency departments or other aspects of medicine. Feel free to let me know in the comments below. In the future, I'm likely going to be talking about stroke symptoms, as this is a very common diagnosis that's important for all of us to know. So stay tuned for that. Thanks again, and I'll see you next time.